Cirrhosis, non-bleeding esophageal varices, treatment beta blocker or band ligation. For active bleeding, octreotide or endoscopic sclerotherapy. Elderly with major depression, suicidal. Treatment ECT or antidepressants and antipsychotics. Neck masses, anterior to neck, thyroglossal cyst. It can become infected after upper respiratory tract infection and thus drain. Lateral to neck, lateral to sternocleidomastoid, branchial cleft cyst. It can also become infected and drain mucopurulent fluid and from sinus tract. Posterior triangle of neck, cystic hygroma, formed from dilated lymphatic vessels, diagnosed at birth or prenatal ultrasound. Maternal hypertension, uteroplacental insufficiency may cause asymmetric fetal growth restriction. Iron deficiency anemia, RDW increased, TIBC increased, MCHC decreased. In hereditary spherocytosis, MCHC is increased. Conjunctival injection, pale follicles, tarsal inflammation, trachoma, chlamydia trachomatis. Analgesic nephropathy, tubulointerstitial nephritis, papillary necrosis. Aortic dissection. If patient is unstable or has renal failure, then TEE is the diagnostic test. But if stable patient or no renal problem, then CT angio. HIV patient can get live attenuated virus vaccine, varicella or MMR, if CD4 count is more than 200, not if CD4 count is less than 200. Inspiratory stridor worse on crying. Stridor improves with prone position, laryngomalacia. In vascular ring, stridor does not improve with prone position. Instead, it improves with extending neck. Barky cough, inspiratory or biphasic stridor, and infectious symptoms. Its group laryngotracheobronchitis, parainfluenza virus, and its acute presentation. Brief psychotic disorder, schizophrenia like symptoms but for less than 1 month. Acute stress disorder, PTSD like symptoms but for less than 1 month. DLCO, normal in chronic bronchitis and decreased in emphysema. Precocious puberty, long bone fractures, and hyperpigmentation. McCune-Albright syndrome. Treat hyperkalemia with calcium gluconate when it's acute, potassium is more than 7, and there are EKG changes. RDS risk factors, prematurity, and DM. Zenker diverticulum treatment, cricopharyngeal myotomy, and diagnostic test is barium swallow. Tender mass near tip of coccyx draining mucoid fluid with pressure, pilonidal sinus. Restless leg syndrome, treatment dopamine agonist like pramipixole and ropinirole. Quick quiz. Cirrhosis, non-bleeding esophageal varices, treatment beta blocker or band ligation. Elderly with major depression and suicidal, treatment ECT. Mass lateral to sternocleidomastoid. Branchial cleft cyst. Asymmetric fetal growth restriction. Cause maternal hypertension, uteroplacental insufficiency. RDW increased, TIBC increased, and MCHC decreased. Iron deficiency anemia. Conjunctival injection, pale follicles, tarsal inflammation. Trachoma, chlamydia trachomatis. Analgesic nephropathy, tubulointerstitial nephritis. Aortic dissection, diagnostic test. Unstable or renal failure, TEE. Stable patient or no renal problem, CT angio. HIV patient can get live attenuated virus vaccines if CD4 count is more than 200. Inspiratory stridor worse on crying. Stridor improves with prone position. Laryngomalacia. Barky cough, inspiratory or biphasic stridor, infectious symptoms, croup. Schizophrenia like symptoms but for less than 1 month, brief psychotic disorder. PTSD like symptoms but for less than 1 month, acute stress disorder. Normal DLCO in chronic bronchitis. Precocious puberty, long bone fractures, hyperpigmentation. McCune Albright syndrome. Treat hyperkalemia with calcium gluconate when acute potassium more than 7 EKG changes. Respiratory distress syndrome risk factors, prematurity, and DM. Zenker diverticulum treatment, cricopharyngeal myotomy. Tender mass near tip of coccyx, draining mucoid fluid with pressure, pyrenoidal sinus. Restless leg syndrome treatment, dopamine agonist, pramipixole, ropinirole. Thank you.